Hello again, and welcome back to Navy Cross Episode 3. I'm Petty Officer Cross, your host. Today we're going to be talking about the physical and nutritional preconditions to make sure you excel at the Navy Advancement Exam, covering several topics. Topic 1, schedule. If you know the advancement exam is going to occur at 0630 and you're used to coming into work at 07, 08, what have you, then you can anticipate the time, wake up early for a few days to, let's say, a week before that. That way, when you are going into the exam, taking the exam, you're not going to be groggy. You'll have all the mental focus required based on your sleep schedule. Tip 2 is to study in the morning. Since you're already going to be up, you might as well get your body conditioned to the idea that you're going to be testing and exerting a high amount of mental energy at the time you're going to be taking the test. If you can go for longer periods of studying, let's say on a weekend, that's also going to get your body into the mindset that, hey, we're waking up at this specific time, the time you're going to be taking the test. We're going to be studying on the same concepts for a long period of time to develop your sort of mental endurance. Most people can study for just a few minutes, 30 minutes tops. They start to get groggy, bored, have to get up, do something, get some food. Practice like you're going to fight, right? Sit down, study for as long as possible at the time you're going to do it. Get your body ready for that mode. Tip number 3, blood flow to the brain. Most people are not getting anywhere near adequate levels of blood flow to their brain to enable them to exert mental energy, right? If you are curious, you can read the book Spark, The Revolutionary Science of Exercise in the Brain. It covers a lot of these topics, but there are a few tips and tricks we can give you. Tip number 1, exercise. If you can handle it with the sleep schedule we just talked about, wake up even earlier, do some high-level cardio. I'm talking getting your heart rate 90% of max for a long period, let's say 30 minutes, to get adequate blood flow to the brain. You're going to see the effects for like an hour, 2 hours after that, so you want to do it right before you go into the exam, if possible. The second tip related to blood flow is nutrition. I realize cardio in the morning might be a lot to ask. Even if you are doing this, the nutrition will help as well. What you're looking for is foods that increase your nitric oxide levels. The best food, people talk about beets, but even better than beets is something called arugula, salad rocket. It's a little green vegetable. Get a big salad of arugula in the morning whenever you wake up. The trick is to not brush your teeth, just rinse your mouth out with some water, get it out of there. You can floss if you want, but brushing your teeth ruins the effect of the nitric oxide dilation. So it'll dilate your blood vessels, give you more blood flow to the brain. That's going to enable you to have a little bit better endurance during this long multi-hour test. The second part in nutrition for the brain is good fats. This is something you can do right now. Just get omega-3 fatty acids, especially DHA, sources of DHA, docosahexaenoic acid. Good sources are seafood, most seafood, and then walnuts, flax seeds, chia seeds, seaweed, spirulina, chlorella. Eat those, handful of nuts a day, walnuts, chia seeds, flax seeds, that kind of thing, between now and the test. That's going to give your brain that sort of solid stability to stay calm and focus for the test. The final tip is breathing. The test is long, as we talked about. Maybe an hour and a half in, you're starting to get foggy, you're starting to get bored, you want to just fill out the last couple questions, be done with it, be done with your test that day. Try and avoid that if you can, and one good exercise is a little breath work. Breathe in through your nose, 4-second count, breathe out for 6 seconds, and hold your breath. Helps to hold your nose in this case. You might look a little silly, but better to do well in the test, right, than look a little silly. Hold your breath as long as you can. It's going to be harder because you just expelled your breath. What this does is it concentrates your CO2 levels in your blood, and to compensate, your spleen is going to release something called EPO, which is a growth hormone, and more blood cells. This is going to enable your blood to be a little more efficient, going to be an ability to reset during the test in that moment of fog. Hold your breath 5 times and then reset, and then just breathe normal. If you can breathe through your nose, that's better. There's natural nitric oxide creation in your nasal airways, so that should help you. Give it a shot between now and then if you don't believe me. Once again, thank you for watching. This has been Navy Cross Episode 3. We talked about physical and nutritional strategies to help you excel in the Navy Advancement Exam. Thank you for watching.